The Board of Healthcare Funders says COVID-19 has brought about many challenges. It's also exposed problems in South Africa's healthcare system. We're joined by the board's head of research, Charlton Murove, to reflect on the first 100 days of COVID-19. Charlton, good evening and thanks for your time. What have you seen as the biggest impact of 100 days of COVID-19 within the SADC region?
Thank you for having me, and good evening, viewers. So it's quite difficult to summarize what exactly has been the major problems, but so it might sound like I'm all over the show because there are quite many. One of them, which is obviously apparent, is the fact that it's a novel virus. So it's unknown how it's going to move around in terms of the trajectory of treatment. We hear there are always new methods of trying to treat the virus, and from what we've heard today, there's a new drug which is promising. So when there's uncertainty, it makes it difficult for funders to plan. And then obviously the response to the virus also included tough lockdown measures which were implemented across the SADC region. These also bring many challenges to mind in terms of how do we remain relevant and sustainable. In the long term, the economic impact will obviously affect medical scheme membership. So that part is also unknown. And then what will be the cost of treatment? Will we have enough capacity to look after all the patients that will be admitted? That's another unanswered question. And then lastly, the health-seeking behavior changes. People don't go and get care when they need. And we are also worried about how that will impact the beneficiaries in the long term, because sometimes they will let their conditions deteriorate, which will have a bad impact in their long-term health. So the challenges have really been numerous, and some just pop by as a surprise, like access to protective equipment. We never thought it's a problem, but now it has become a big problem, ensuring that the healthcare workers are safe.
Let's stay with the issue of the protective equipment. How broad is this problem? Are you finding it's something that exists in South Africa alone, or is the entire region experiencing this challenge?
So it's a very acute problem, and it's not restricted to South Africa alone. I think it's even more acute in the SADC region. The lockdown actually made it difficult for cross-border commerce to take place. So most of the SADC countries usually buy their materials, medical equipment from South Africa. If they don't get it from South Africa, it normally comes through South Africa. So for them to get access to the much needed medical equipment has been very difficult because of the lockdown. And then if you are further down the supply chain, it makes it difficult for you to feature top on the suppliers list, because South Africa has to satisfy its requirements first before they can ship out the equipment to other countries in the region. So it's still a challenge, though it looks like people are adapting and things are getting better at the moment.
The moment has also required agility from governments, but also from medical schemes in terms of how they approach their clients during a pandemic such as this. Where have you seen the biggest concessions taking place, and perhaps even the changes taking place in terms of how medical schemes are trying to accommodate many of those who are feeling the economic impact that has come as a result of this crisis?
So medical schemes have really found it difficult to navigate the space because of the strict regulatory environment in which medical schemes operate. First of all, as a result of the lockdown, a lot of people lost their incomes. So for them to sustain their medical scheme membership has been a challenge. And then as medical schemes, we are concerned about that, and we did not want to have members dropping off the schemes because of the lockdown or because they cannot afford. So we tried various avenues in terms of trying to give members contribution holidays or contribution debt. Obviously, we had to look at what is allowed within the regulatory space. So some members were allowed to have contribution debt, and in very few circumstances, they were allowed to have contribution holidays, where a scheme actually uses reserves to cater for the members. And this was really done on a case-by-case basis, because medical schemes do need the contribution revenue to pay for claims. So it's not a blanket thing which can be afforded to every medical scheme member, but it was afforded to those very unique circumstances where beneficiaries couldn't afford to pay contributions. Then the other important stakeholders who were affected by the lockdown are the healthcare providers, the GPs, the doctors, and even the hospital groups. People stopped going to utilize the health facilities, so their revenues also dropped, and they dropped quite significantly. So they were faced with sustainability challenges. But once again, there is very little that the schemes can actually do to help the healthcare providers, because they cannot offer loans or even give money unless a patient actually goes out to see a healthcare practitioner.
Of course, one of the other things it's done is that it's like every other sector, it's pushed the medical field then to go ahead much further in terms of how technology is used. We've seen the introductions of telephone consultations taking place for the first time in South Africa. Do you think that interventions like that are going to be worked on, and that may in fact become the norm now for going into the rest of the future?
Yeah, we certainly hope that telemedicine remains with us for a significant time. It is very much needed, especially in a country like South Africa, where you have an equal distribution of healthcare resources, where you have a lot of specialists who are situated in the major metropolitan areas. But with telemedicine, you now can have someone in rural Limpopo being able to consult with a specialist without having to travel a couple of 100 kilometers. So the introduction of telemedicine has really been positive, and we are seeing that there's a significant uptake in terms of beneficiaries being able to call in their GPs or their caregivers as necessary. That has been really a positive, and we hope it is sustained even after the lockdown.
Charlton Murove is with the Board of Healthcare Funders of Southern Africa.